So as I mentioned, the Jewish Federation of Ottawa Choices is an outreach initiative in which women are brought in from all corners of the community and all corners of the world for an evening that features a keynote speaker sharing their personal, life-altering stories and how those choices that they've made along the way have shaped their lives and, in many cases, the lives of others, to encourage women and inspire them to get involved and make choices and affect change in their community. Tonight's guest speaker is Dr. Livia Kapusta, who moved to Israel, had been educated in Israel, moved to the Netherlands, and then went back to Israel to be part of a cardiac team of surgeons at Save a Child's Heart. And she joins us now on CFRA. Dr. Kapusta, thanks very much for dropping by. Appreciate it.
Thank you very much. Good morning.
Tell us about Save a Children's Heart. This is outreach to the developing world, the so-called third world, to give pediatric care to kids in those other countries.
Correct. Save a Child's Heart is actually an NGO situated in Israel, recognized by the United Nations last year. And it's actually an organization that believes that every child is a child and deserves help whenever, whatsoever, religious, color, place where they come from, whatever. A child is a child. And we try to do so. And we do it in 3 different ways. We are going out and reaching the patients in the country of origin. So we go on missions, international medical missions, where we meet our partners abroad, because we always need also local people in order to reach the children and to talk to them, to translate, to check, whatever. It's not something that you just go, do, and disappear. You also want it to be sustainable. So you need partners also all over the world. The second thing is what we do is we train medical staff. And we do so in Israel. We've already done 73 nurses, doctors, other medical staff, and they are going back to their country of origin, and they help to spread the help all over the world, which is very, very important. And of course, we keep doing surgeries, which is actually the life-saving procedure that you need in order to save many children.
And you said there was a third aspect, and that's the surgeries that take place primarily in Israel, or
yes.
do you do the surgeries in some of the developing world?
We do also in some of the countries. I would be very careful to say developing countries, because I don't think that China is a developing country. But even in big countries, in very developed countries, there are some places where we could add something to the medical study or medical education, or even just practical help, and we do so. So we did operate in China a few times, and also in Africa and in Moldavia. And most of our children, we have already operated on 3,000 children. Most of them half of them from the Palestinian authorities, and half of them from 43 other countries, mainly in Africa.
How do you recruit your doctors? Does this become something that they do full-time, or do they lend their services to you for a specific case, or do they say, okay, for 6 months or 2 months, I'm yours? How does it work?
Yeah. I think that both are important. The core business is actually people who are working full-time in Save a Child's Heart in Israel. In Holon, it's a small city in south of Tel Aviv. Because you need something that is very basic and on daily ongoing business, not every time somebody else. But part of the work is also important, is to engage some other people. We were very lucky. We have been yesterday into the Heart Institute of Ottawa, and we were extremely nicely welcomed there. And one of the things that we talked with the doctors was trying to see whether we can get somebody from here for few months coming to Israel, going with us on missions, and just getting young doctors to get more involved in humanitarian work, because we have it very good, all of us, and it's nice to give back to the society.
One of the offshoots to this could be better international understanding. You know, you break down political barriers and you talk to people on a human level. So is there outreach by the Israelis into the Palestinian communities as an example, or into other Arab nations nearby?
I believe so. It's not done on purpose. I mean, we don't stand up, go to the radio and tell us we are a fantastic Israeli organization who is doing so. But every one of us who has children, will understand it. Whether you are Palestinian or not, if your child has a congenital heart disease and your neighbors can help, then you reach out for help. And the same family that has been in Israel and seen how they are treated, they will be very good ambassadors for Israel as well.
Yeah. So is it taking place?
Yes, for sure. If you have so many, we have once per week Palestinian clinics only for Palestinian patients. And try to imagine that in the morning or the whole night the rockets were falling in Israel and perhaps also in somewhere else. And still in the morning, children are coming. They have to pass through the checkpoints. They are being welcomed by a fantastic Christian organization which is called Brothers Together, and they bring the children to Tel Aviv, to the hospital, and the same nurses that are living in this area where the rockets fell last night, they are helping us to treat the children.
Boy.
So it's a win-win situation for both sides.
Sure is. And it's interesting that the Christian organization is acting kind of as an intermediary, as a bridge of trust, etc.
I think it always was like this, and it should be like this. It doesn't matter whether you're Muslim, whether you're Jewish, or whether you are Christian. You need to help one another. And instead of dealing with politics, we are dealing with just human feelings. And as doctors, to be able to do that it's just wonderful.
Tell us about the experience from the point of view of being a physician and now getting involved in this humanitarian work. What has it meant to you?
Well, I always say that my life changed in 2006 when I went for the first time on mission with Save a Child's Heart, still as a pediatric cardiologist from the Netherlands, to China. And in my eyes, I thought, well, what can they do there? And it didn't sound very real, but okay, I thought I'm going to see and judge for myself. And after seeing the children there in that week, thousands of people standing in line with one child in their hands, waiting for hours to be diagnosed, to be actually just to have somebody, it just gave them so much hope, and it gave me such a good feeling that we are doing something good. Then came back, went to Amman, also on a mission. So Palestinian children, then went to Africa, to Tanzania. So the African children, always with a big smile on their face. And to see a mother after such an operation, when you have children, but even I think also if I wouldn't have children, still the feeling of doing something, the smile on the face of the patient when they go back, it says it all.
Yeah. Tonight's session is about, making choices and questioning whether one has chosen a path that will leave the world a little better when we pass on.
Yeah.
How do you encourage women who are tied down by their circumstances? I've got a young family. I can't just take off for Africa for a week or two or for a year or two. How do you encourage them to feel that, I am making a difference. I have contributed to a better place?
It's all a question of making choices. So even if you have very little time, you can still do a lot. I'm sure that everyone is doing a lot. We don't know it always, but even helping your neighbor is a choice of helping someone. But when it concerns Save a Child's Heart, we have here an affiliation in Canada, which is called Save a Child's Heart Canada, www.saveachaldsheart.ca.
Right.
And they have a whole plan and a whole bunch of ideas what one can do in order to fundraise money for the organization, or at the level of school, what the children can do. And I'm sure that many people have also more ideas that they could tell us what we can do. But once you decide to help, you can always find the way how to do it, whether it's with time, energy, money, smile, telling the story further, being here on a radio program is also a way of helping. Everything.
Spread the word.
Spread the word, yeah.
Volunteerism in this community is among the highest rates of volunteerism of any country and any city in this country. And I think your talk tonight is going to be inspiring to the 300 women who'll be there. I appreciate you coming and joining us this morning. Good luck with the wonderful work being done by Save a Child's Heart. Appreciate it.
Thank you very much.
Dr. Livia Kapusta, originally from the Netherlands and now practicing physician in Israel, visiting Ottawa as part of the Choices program put on by the Jewish Federation of Ottawa's women's fundraising team.